Having some kind of plan or safety net for medical care or an emergency has become a must for many working South Africans. But how many of us know exactly what our medical aid offers, and how do we choose? There are so many options out there that deciding what is best for you can be rather overwhelming. Today on Medical Matters, we look at the ins and outs of medical aid. There is nothing worse than finding yourself in an emergency room or being told you're going to need treatment and then realizing you can't afford it, or if you have medical aid, that you're not adequately covered. It's therefore vital that you understand what medical aid is, what your current plan covers, and what you would be expected to pay out of pocket.
The purpose of a medical aid is to cover your healthcare expenses, and it's also there as a safety net for if you had any type of catastrophic illness or injury. So it's a really good way to make sure that you and your family are covered and to keep you healthy.
With the exorbitant cost of living these days, healthcare is often the place people choose to cut down. Some even wing it and go without a medical aid. Now, this might be fine if you're a healthy single person and manage to put some money aside every month for medical emergencies. But if you are someone who gets sick often, or if you've decided to partner up and have a family, you might want to consider the benefits of having a medical aid plan.
So in the medical aid industry, one of the most important things we have is what's called prescribed minimum benefits. Now, these are conditions of acute conditions that happen suddenly or chronic conditions that are legislated by the Medical Schemes Act that medical aids must cover. So you have that safety net to know that if anything like that happened to you, you know that you are guaranteed cover, obviously in line with your benefits and your coverage.
And be sure to know exactly what your medical aid offers. Remember, paying for medical aid every month doesn't mean you are covered for absolutely everything.
Always read the guides that your medical aid sends out to you, explaining your coverage and how your medical aid works. Always read your scheme rules to understand also what is covered and what's not covered. Medical aid does not cover everything just because you pay your premiums.
Avoid nasty surprises like your medical savings account being exhausted or having to make a co-payment when you least expect it by familiarizing yourself with how these work and what the limits are.
So some of the nasty surprises could be that you go to your doctor and they prescribe a specific medication and it's not covered. So for example, medical aids can have what's called formularies, specific drugs that they will pay for in full. Or you could even have co-payments if your drug is not on that list. You may be asked to only get your chronic medication at a pharmacy that is specific to the network that you're on. If you don't go to that network pharmacy, you then could get a co-payment. Same thing with hospitals. So always look at the benefit that is with your plan and always assess, does my plan fit my needs?
So with all of this in mind, how do you choose the right medical aid for you? What are the things to look out for when choosing a plan? And what questions should you be asking pertaining to your particular needs?
Look at your own healthcare needs. Are you by yourself? Do you have a family that needs to be covered? Are you looking at having children? Do you want a maternity benefit? Would you like glasses, dentistry? Are you comfortable with going to the public healthcare system? So always assess your healthcare needs. And there's nothing wrong with always having a so-called backup plan when it comes to healthcare. Because when you get sick, you can get very nasty surprises in terms of the costs of healthcare and what is required of you to pay in terms of your treatment, to your doctors, and even hospital admissions.
Whatever medical aid plan you opt for, make sure you're aware of what each one offers you. Look at your medical needs and circumstances when making the choice. If you are an older person, this could mean ongoing care at some point, or this could be the case if you're a young person who gets sick often. The last thing you need for you or a loved one is to be denied life-saving treatment because you made the wrong choice.